Cross Family Caregiving Program, and specifically our topic for today, general caregiving skills. My name is John Montgomery. I'm from Always Best Care Senior Services, and in conjunction with the Red Cross, I am your local family caregiver administrator in the area. You know, I come out and I share with people general caregiving skills and other topics for those people who are caring for a loved one at home and would like to get a little bit more knowledge about how they can do a better job with that. So what we have here is there are 8 different topics that we can present on in terms of the family caregiving program here. And like I said again today, we're going to be doing the general caregiving skills. Yet we do encourage home safety. We encourage, learning how to position and move and transfer a loved one properly. Assist with personal care. That could be anywhere from bathing and dressing, other hygiene activities of daily living, healthy eating. Oftentimes, when a loved one needs care, there's financial issues that come up, and we can help somebody navigate through some of those. And then caring for a loved one who has Alzheimer's or dementia, which is a different but also very challenging situation for many people in a caregiving situation. And then also helping care for somebody who has AIDS. So that's what we do here. It obviously seems like most everybody in the room knows each other. So we don't need to introduce each other. Okay, wonderful. And so that is our program, and what again we're going to talk about today is the general caregiving skills. Each of you have a booklet in front of you, and the courses that I'm mentioning here are all outlined on the back as well. If you turn to page 3 of your booklet, we have some basic principles of caregiving that we like to adhere to and bring your attention to. Those being safety, privacy, dignity, communication, independence, and infection control. Can anybody here share with me how these principles may apply to caregiving? The answers are in front of you. But anyway, basically what we want to do is make sure that both the caregiver as well as the care receiver are being treated safely. The caregiver is operating or following safe procedures in the process of giving a caregiver assistance. Privacy is extremely important. We come across it all the time with clients. They don't want to divulge private information, primarily financial information, even to their children, even at a time when they need assistance. So their privacy is extremely important. We found that clients will actually share with us more private information than they do with their own children. Dignity, you always want to treat anybody that's being cared for with as much dignity as possible. They're going through a hard time. Obviously, as a caregiver, you're going through a challenging time as well, doing the job of a caregiver. So there is dignity that goes in both ways. Communication that gets stacked in the middle. I think it should be on the top, the middle, and the bottom. Oftentimes family challenges do come up in caring for a loved one because there's family issues. Mom and dad, don't like the way daughter or son is taking care of them, or doesn't like the way they run their household or whatever. Communication is key. Letting them know, the cared for, what you're going to do, what you're not going to do, when you're going to be doing it, and most importantly, is simply being compassionate. Listening to the cared for talk about, reminisce, talk about things that are important to them, that sort of thing. we talk about assistance with activities of daily living quite a bit in what we do, but at the end of the day, the caring, compassion, and communication that you can give a loved one or somebody that you're caring for is of utmost important. And so I really have a passion for that particular topic. You want to encourage somebody that you're caring for to be as independent as possible, even if they don't want to get themselves out of bed or they don't want to transfer, they'd rather sit in the chair and be wheeled somewhere. You really want to encourage as much independence as possible in terms of when you're giving care to somebody, because oftentimes it's easy for them to kind of concede to their aging process, and you don't necessarily, I mean, you don't want to overdo it, but at the same time encourage somebody to do as much as they can for themselves. And then infection control is of utmost importance. Everybody's situation when caring for a loved one is going to be different, with the basic equipment that you're using, procedures that you're going to follow. So it's important for you to make sure that you're following the directions of the doctor or nurse or whomever is giving you instruments and tools to work with a loved one. So those are the basic principles of caregiving that would apply to any one of these modules in terms of basically getting care to a loved one. Does anybody in this room now currently care for a loved one at home? Are you comfortable with sharing with us any of the challenges that you face, or they can't be many?
That's why we're here, John.
It doesn't have to necessarily be a list. If there's a few pet peeves or things that you want to share with the group, and you don't have to either. I mean, if it's private to you, that's okay too.
Oh, well, pretty much everybody here knows what we're facing, because we gather like this often and share. So I don't want to take up your time with that, but basically ours is a dementia problem.
Okay.
So the communication piece is very key.
Absolutely.
For us, because we have to be careful when we share things. Not too early and not too late. All that's important.
Okay.
And personal hygiene is really a problem right now.
Absolutely.
For us, because I'm the one that does that for my mom, and she doesn't want anything to do with that. So it's a real struggle right now, because I know how important it is for her overall health. So.
Sure. And that is a challenge, especially if the loved one does not want to concede to bathing. We come across that often, especially with somebody suffering from dementia or Alzheimer's, in terms of not wanting to participate. And sometimes you have to play a little trickery to get them to do what you need them to do to be clean and that sort of thing.
You have to get into their head ahead of time to know if they're ready to even approach the subject.
Yep. Yeah.
And I know when it's not a good time, and I just stay away from it, and we do the best we can. I don't stress over it too much. If I can't get a shower done every week,
Sure.
If we can do some bit cleaning, bathing, and like sponge type bathing. In between, we do that.
Okay.
But we do the best we can.
Understood. Do you have anything to share?
I have my in-laws live with me. They're 86 and 87.
Okay.
And they have physical problems. They have a lot of health issues. But for their age, I think they're doing okay. We have severe arthritis with my mother-in-law, and father-in-law has macular degeneration in the knees, but their minds are still good. And however, they're very frustrated by how they're aging.
Sure.
And they don't like not having the independence that they used to have. They're very self-absorbed.
Very typical. Especially
so,
somebody who is suffering from Alzheimer's and memory loss and memory challenges often don't have that anger, because they're just kind of drifting somewhere else in their life. Whereas somebody, it's more often more challenging to work with somebody. I shouldn't say more challenging. It's not really the appropriate, but it's just different in terms of somebody who is angry about the fact that they're not able to do the things that they once were, and they're not independent.
So we have to be very careful with what we say, but we always make sure that we're very positive. And even though they haven't had a good day for whatever reason, we always try to find something positive to talk about. You know, the kids, or something that happened at work that's positive, or just something, you know, opposite.
Okay. Does anybody else have anything to share?
Part of the reason I came here today is my dad has Alzheimer's and my mom's the primary caregiver. They live down south, and she has to have knee surgery. So she's going to be out of commission for 3 or 4 weeks, and so my sister and I are both going to take turns assisting, with not only her, with my dad, and he doesn't know who I am anymore. I mean, I think he knows somebody that is in the family, but he doesn't know. And so I'm kind of anxious because my mom is doing all the hygiene stuff. And I mean, he does a lot, but when it comes to that, he doesn't know. So I mean, I've raised kids, but
You haven't raised an adult.
No. So I'm a little anxious on how to approach that, right? Because I don't know how amenable it'll be to me. My sister, who's going to be there the week before me, is a nurse, so she's, I'm going to say her comfort level is higher. She obviously has that skill set, but I'm pretty anxious about that task.
I can understand that. Yeah. You know, I would be anxious too. A lot of cueing, a lot of communication. You know, Dad, well, I mean, you may not even choose to address him as Dad if he doesn't know you. You may try it at first, and you know, who are you? Are you my daughter? Or, you know, oh, it's nice to meet you, and that sort of thing. What do you do? Where do you live? You know, all those questions kind of come up. A lot of cueing. Just, we're going to do this next. We're going to do that. And it's not, would you like to? It is, we're doing this. I mean, what happens is as somebody progresses, we're children and we're directed and we're told what to do. We hopefully become adults, and then there's a time in our aging process where we need to be cued again. Like you would cue a child. So some of those child rearing skills that you had in terms of, you know, it's my way. You don't have a choice. And that's hard, especially for a daughter to a father. But he's not your father that you once knew. He's in a different place now. And so it certainly is understandable to be anxious, but if I could give you any encouragement, it would be to go in there with your, put your mom hat on. And, you know, pretty much this is what we're going to do, and this is when we're going to do it. And there isn't a lot of choice, especially with somebody with memory loss challenges. As you seem to be in agreement. So, fair enough. General question to everybody, what is it that you'd like to get out of this this presentation today, or this particular module? Does anybody want to share that? Okay.
Just more information. Go ahead, Scott.
My situation is my stepfather is in a nursing facility, Alzheimer and dementia unit. What I'm hoping to take away is how, while I'm concerned about the general caregiving skills because they're doing a lot of it, but sometimes I think there's delays because he doesn't want to have it done, how I can partner with them. Okay. And when do I raise my hand and say we have a problem, and when do I just let it run its natural course?
Fair enough. We're going to talk about charting. We're going to talk about taking vitals. We're going to talk about respiration. We're going to talk about blood pressure, that sort of thing. Those are things that you can kind of ask the people at the facility to share with you. You know, where's your documentation? Is he at baseline? You know, when are these things happening? They do journal and keep a lot of those records, and that may be a way to help you monitor a little bit more of what they're doing. If you think that the community isn't necessarily doing what they should be, again, asking to see that documentation may be the prompt that they would need to maybe make sure that they're paying a little bit more attention to your dad if you suspect maybe they're not doing things in a timely manner. And that would be one suggestion there. Anything else? Okay. Again, what we're going to talk about today is basically taking blood pressure, taking the pulse, journaling these things, and being able to communicate these types of things with the caregiver. So the caregiver, being a professional doctor, nurse, whoever you're working with, can make decisions on what diagnoses may be happening, what medications may need to be adjusted, those sort of things. What I'm going to go ahead and do is we will go ahead and watch a 12-minute video that covers these topics, and we can open it up more to question and answer or reiterate a little bit of what we see in this video. Oh, what did I just do?
Right click.
I think I just...
Each caregiving situation is unique. For some, the caregiving role may only include handling loved one's finances or providing emotional support, while for others, care involves helping with daily activities, such as bathing, eating, and dressing. Healthcare providers may recommend to some caregivers that they regularly take their loved one's vital signs, such as blood pressure, especially if their loved one has high blood pressure. In this section, we'll show you how to measure a loved one's vital signs and demonstrate how to give medication. We'll also discuss how to keep track of all this important information so that you and the healthcare provider can accurately monitor your loved one's health. Let's take a look at what you need to know to get started. Your healthcare provider may request that you record your loved one's vital signs in a notebook. If so, take your loved one's vital signs at about the same time each day and evening so that the healthcare provider can accurately compare the readings. Let's begin with body temperature. A person's body temperature tells the amount of heat in the body. A temperature increase can indicate an infection. Body temperature can be measured in several places: the mouth, the rectum, or the armpit. It can even be measured in the ear with a special type of thermometer. Do not take an oral temperature if your loved one is receiving supplemental oxygen, having trouble breathing, confused or unconscious, paralyzed on one side of his body or face, breathing through his mouth, or if he has a tube in his nose, or is under the age of 5, recently had mouth surgery, or has a mouth disease. Also, delay taking your loved one's temperature if he has eaten, smoked, or had anything to drink within the past 15 minutes. If you don't have a digital thermometer, you can purchase one at the local drugstore and follow the package directions to learn how to use it. Measuring the pulse provides information about how your loved one's heart is working, and this information helps the healthcare provider plan his care. You can feel the pulse in several places on a person's body. Most of the time, it's convenient to take the pulse rate at the wrist. To take the pulse, make sure your loved one is in a comfortable, relaxed position. His arm should rest comfortably on a flat surface. Find the pulse on the thumb side of his wrist. Gently press your fingers over the pulse. Using the second hand on your watch, count the number of beats for 1 minute. Start counting when the second hand is at 12. Record this number in the notebook as well as the time of day. The pulse rate of an average adult ranges from 60 to 100 beats per minute. Once you feel comfortable with these skills, you can save time by combining tasks. For instance, because you usually take all vital signs at the same time, you may wish to take a person's pulse while waiting for the temperature. Breathing rate is another important vital sign. A person with normal respiration breathes quietly and easily. When your loved one is breathing normally, the breathing seems effortless and regular. When taking respirations, Try to count his breaths without him being aware of what you're doing, so that he won't change his rate of breathing. A good time to count your loved one's breaths would be just after taking his pulse. If you keep your fingers on his wrist, he may not be aware that you're counting his breaths. Count breaths for 30 seconds, counting one rise and one fall of the chest for each breath. Multiply this number by 2 to get the rate for 1 minute. A healthy adult will have a respiration rate between 12 and 20 breaths per minute.
Dad, are you feeling okay?
Difficult or noisy breathing is considered abnormal. It's a sign that your loved one is experiencing some medical problem. You can tell if breathing is abnormal if he sounds like he has a rattle or wetness in his chest, if his breathing is uneven, if his lips look blue or gray and the base of his fingernails look blue. Contact your healthcare provider or call 911 or your local emergency number if breathing becomes seriously abnormal. The healthcare provider may recommend that you monitor your loved one's blood pressure, especially if he has hypertension or high blood pressure. A variety of automatic blood pressure machines in a variety of price ranges are available at most drugstores. These machines can make it easy for the caregiver to take the loved one's blood pressure. When using a blood pressure machine, be sure to follow the manufacturer's operating instructions. It's also important to check the accuracy of the machine at a healthcare provider's office at least twice a year. And now we move on to the very important topic of medicines. Your loved one may be taking medicine that's been prescribed by the healthcare provider, as well as over-the-counter medicines that you can buy without a prescription. Both prescription and over-the-counter medicines can provide valuable benefits, but they can also cause serious problems. Be very careful to ensure that your loved one takes medications exactly the way the healthcare provider advises. Your loved one may be capable of taking his own medication, but if he needs help, make sure that he is sitting up in a comfortable position. If he is able to place the medicine in his mouth, place one tablet or capsule at a time in his hands.
Can I hold you up? Oh, okay.
If he is unable,
Seem to be having some trouble. Open your mouth.
place the tablet or capsule on the back of his tongue. Then give him a drink of water to help the tablet or capsule slide down his throat. If your loved one has trouble swallowing, try putting the tablet or capsule in a spoonful of food, such as applesauce, but only if his diet allows him to eat applesauce. Make sure your loved one swallows each medicine before giving the next one. You're probably aware that tablets and capsules come in a variety of sizes and colors. In fact, very often different generics of the same medicine may come in different colors or sizes. But you should also be aware it could be very dangerous to automatically associate one color or size with a particular medication. Also, don't depend on your memory when giving medicine. Always check the label to make sure you give the correct medicine and dosage. Keep a magnifying glass and a good light near your medicines so you can read the labels.
Mom, it's time for your medicine. Oh my, gotta take care.
If your loved one needs help taking liquid medicines, follow these simple steps. Shake the bottle well if required. Measure the dose into a medicine cup. Put the medicine cup up to her mouth and give her the medicine as you would a beverage from a cup.
Here's some water. I know, it doesn't taste very good.
Always follow the directions on the label for storing liquid medicines. Some medicine needs to be refrigerated. If you are required to give him eye medicine, follow these steps. Wash your hands. Have him sit comfortably with his head tilted back, and be sure you know which eye will get the medication. Standing beside him, use a tissue to gently pull down the lower eyelid. If he needs drops in both eyes, use a different tissue for each eye. Put the correct number of drops into his eye closer to the nose. After you put in the drops, continue to hold the lower lid down for a few seconds to let the drops settle. Then, let go so that the lid touches the eye. Ask him to close his eyes slowly, without blinking or squeezing, to help distribute the medicine. Make sure that the drops from one eye do not drip into the other eye. This can spread infections such as conjunctivitis or pink eye. And one last thing. Be sure to check with the healthcare provider before using a generic liquid medicine as a substitute for a prescribed brand medicine. If your loved one needs eardrops, have her lie on one side so that the ear that needs medication is facing upward. Open the ear by gently pulling the flap of the ear up and back. Put in the prescribed number of drops. Have your loved one stay on her side for approximately 20 minutes to make sure the medicine flows down into the ear canal. You will usually see a bubble rise if the medicine has gone into the ear canal. By now, you've learned general caregiving skills, such as how to measure and record your loved one's vital signs and how to properly identify and administer medications. These skills will help you work with your healthcare provider to take care of your loved one. For further information, refer to the booklet available from your local American Red Cross chapter, Family Caregiving, General Caregiving Skills.
Questions about what you just saw? It's recommended when, they didn't really go into it as deeply in the video, but it is recommended that if you have a glass thermometer, they are dangerous, they're chip risk. There's mercury inside of those glass thermometers. As a kid, that's all we had, and that's what we used, but there are digital thermometers today, and it is recommended for safety purposes that you use a digital thermometer where possible because of the potential hazard with the mercury and chipping and that sort of thing.
John, one thing I found interesting, that with the pulse, they say to take it for 1 minute,
yeah,
and yet for the breathing, they say to take it for 30 seconds, yep, and then times it by 2. Why wouldn't you do the same thing?
I often do pulse 15 seconds and multiply it times 4. Because over the course of a minute, there's a lot of time that goes by there, and it's because we're all going to practice taking our pulse in just a second, but nevertheless, yeah, there's the other inconsistency that I see in the video is that why aren't they wearing gloves when they're provided to do it, especially with the eye drops and that sort of thing. They're talking about not having, the cross-contamination yet. She's not wearing rubber gloves. I'm not here to beat up the video, but there are, a couple of things that I've noticed there as well. But, I would suggest you do differently, especially with the glass thermometer. A lot of the notes for this particular caregiving course, they spend a lot of time talking about don't use a glass thermometer, but they don't really provide that in the video here. If you turn to
John, one thing I noticed was that all of the people receiving care were quite cooperative, even the lady who didn't want to take her liquid medicine. Before my mother-in-law moved into the nursing home, she suffers from dementia, and it was occasionally, she would absolutely refuse to take pills, and rather than say, you must take it right this minute, we'd wait 10 minutes, and she'd have forgotten that she'd refused, and try again. The onus is on us to remember to try again.
Sure.
But sometimes they're not quite as cooperative.
Without a doubt. Again, I'm not here to beat up the presentation yet at the same time. They're showing you a perfect world where, the gentleman she's holding his eye open for, the better part of 20 seconds and before she got a drop in there. I don't think that, I'm making the assumption that they're depicting a father-daughter sort of situation. I'm sure a few exploits would have gone on at that point. But nevertheless, yeah, it's challenging, taking care of a loved one. And again, example purposes, they look pretty easy. But the way you handled your mother in her situation and not taking the medication is especially somebody with memory challenges, that's the best way to do it, is oftentimes a short period will pass and they will forget that there was even an issue and that medication can't be administered. And one of the test questions that we provide for caregivers as we're evaluating them talks about somebody with dementia who insists that there's an intruder in their room stealing, jewelry and other articles. And what do? Do you change the subject? Do you pretend that you've gone in and apprehended this person and taken them out of the room? Or I forget what the other choice is. But the correct answer is pretend you've apprehended this person. As somebody with mind challenges and memory challenges, oftentimes you have to understand that even though what they're saying is complete gibberish, to them it's real. There's an intruder in this room and we got to get it out of here. And you kind of have to go to their level and say, okay, I'm going to go apprehend. Sometimes a simple, let's go take a ride, get in the car, drive around the block, pull up to the house, go back in the house, and whatever issue was there can be gone as well. I mean, there's different ways of handling people with memory loss, and the way you were handling it is appropriate. I would encourage you, like you said, okay, did I give mom medicine or not? Did she take it or not? Journal. I mean, the one thing that they start with at the beginning of the video talking about is, it's the importance of maintaining a journal, and oftentimes, you don't always do that, but that is something that, so that you do remember, so that you can communicate with the doctor, the healthcare provider. Okay, this is what's going on. This is the journal that I've been keeping. This is what I've been doing. Sometimes mom is cranky at this hour, and that journal will actually help you identify or potentially identify troubled times, troubled situations during the day, or if you take a journal and say mom didn't want to take it at 12, at 12:20 she was okay, there may be a pattern that you will uncover in your caregiving process with your loved one simply by journaling. So what I'd like, please.
I had a question about patients that are on oxygen and not using an oral thermometer. So if they have the type of tubes that go right up in the nostril and not a full face mask, would it then be okay?
Sometimes that oxygen can either heat up or cool down the mouth, and so you're not going to get an accurate reading from somebody who's on oxygen. So it's better to go under the armpit or somewhere else for somebody on oxygen.
One of the things we noticed is when my mother got sick, we had to move her out of the house and take her to the hospital. That was very distressing to her.
Oh, absolutely.
In fact, it was almost worse than what was wrong with her. I mean, to get her back to where she was, it was just horrible. When I saw that about the oxygen, and what if your person, doesn't breathe right, or the breathing is irregular or something like that, is it permissible to have an oxygen tank in the house for an emergency situation?
Yeah.
And that is something that your doctor would
say that would have to be prescribed by your doctor, and you would want to get some basic training around how to use it when it's appropriate to use it. And again, every caregiving, everybody's personal situation is different. So that having oxygen in the house, if you and your doctor consult about it and decide it's a good thing to have, you're also going to need to get direction or prescription from him on when it's appropriate to use it, when it's not appropriate to use it, and then how to go about using it. And usually the medical supply company will help you. A visiting nurse can help you with actually how to use it, but you should definitely follow the doctor's prescription on when to use it and when not to use it.
Yeah, I was thinking of that because I know the last time she was in the hospital, she was diagnosed with COPD, and we didn't even know she had that. So there could be a time when her breathing does become
irregular, and a little bit of oxygen would help, because that also can lead to anxiety. In terms of, I'm not breathing properly, what's happening? They start to self-diagnose, and oftentimes a loved one will fear the worst as opposed to seeing the glass half full, if you will. So that's something that you can definitely have oxygen, but under doctor's prescription. The next part is, we take our own pulse. I think we all know how to take our pulse, if anybody wants to give it a try. But there are, if you turn to page 12 of your booklet, it talks about different language that you can use with your care provider in terms of describing somebody's pulse. If somebody's pulse is ticking like a clock, it's very regular, blah, 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 you describe to the doctor that this is a regular pulse rate. If on the other hand it's uneven, there's breaks between pulses and that sort of thing, you pretty much describe that as an irregular pulse rate to your care provider. If it's if it's a good force but not a bounding force, you would just pretty much say that this is an easy force and it's not too strong or not too light. On the other hand, if you do find it to be a strong force, you call it a bounding force when describing it to the doctor. If it's weak, you would describe that as being thready. And again, oftentimes when you are taking, I know that when I go to the doctor wants to put me on a water pill and I'm fighting them because I don't want to go on a water pill, and she's watching my blood pressure very closely. And every time I go there, they have to take it about 3 times, because the first time they take it, I'm anxious. Because I know that they're checking me out, and I know that they're suggesting that I go on to a water pill and I'm fighting it. So they'll take 3 different measurements and they'll get 3 different readings. And they can usually discard a slightly elevated reading as, okay, he's anxious. And that's the same thing that happens when you're caring for a loved one. They know that you're coming in and you're checking them out and that sort of thing. There are times when you may be taking a pulse, they may be thinking, oh, they're going to send me to a home, or am I going to have this happen, or am I going to have that happen? And it could be an anxious situation for them. So that when you are taking vital signs, again, this is where communications comes in very handy. Is, Mom, I'm just checking you out, making sure that you're okay. There's nothing wrong. I just want to make sure that everything is status quo. You're at, I wouldn't use the term baseline, but status quo, because it can be an intimidating situation for a loved one when you go in there and start checking some of the vital signs. Watching the breathing is something that they don't even need to know that you're doing. You're just watching, the chest go up and down and counting that. I mean, you can, if you can walk and chew gum at the same time, hold a conversation with somebody and count their breathing. Sometimes that's difficult, especially if you're trying to get an accurate measurement. You don't necessarily want to engage somebody in conversation while trying to watch their breathing. But you can monitor that without them even realizing it, just by being in the room, that sort of thing, so that to kind of eliminate any sort of anxious situation which could give you a false reading. Are some tips that I've used and I give to our caregivers as well. Does anybody have any additional? This is the part where I've kind of left it open for additional question and answering from you all. This is a support group. If there's any specifics, and some of the questions have been great. Does anybody else have any questions?